today's webinar on a Saturday evening. It's nice to have all of you there. IASO is always keen on academics, and because of Corona pandemic, everybody's into webinar, and so we are also promoting webinar in every form. We had covered different aspects in the past. Today is head and neck, and we're quite lucky to have faculties like Dr. K A Pathak from Canada, Dr. Ashok Shaha from MSKCC USA, and Dr. Kumar from Pravas from TMH. And we have moderators like Dr. S.V.S. Deo from Delhi, Dr. Savant, Rishil Savant, our immediate past president, Dr. Rajendra Koprani, our vice president, who is going to take over after me. At the end, I think Dr. Sharad Desai is going to make some concluding remarks. At the same time, I would like to tell you that we are also having a parallel webinar with CEN. It's with USA, cancer expert now. So if you have been to one of the webinars we did last week, there's one next week on colorectal cancer. It's going to be, with robotic LAR and locally advanced sterectomy. So I think it's going to be all interesting. On 29th, we are doing one from East Zone. Shaikat Gupta is doing on D2 gastrectomy. We have surgeon, faculty like Dr. Takeshi Sano from Japan. And we also have Dr. T.S. Rao, Subramanian Rao, who's going to talk about lap colorectal surgery. So without wasting any more time, I think it's time for Dr. Atul Samaiya, who's the host for today, to take over. And I congratulate him on his wedding anniversary today. He's very kind that he has taken time out of his wedding anniversary. I'm sure his wife is very kind as well. Okay, all the best.
Thank you, Dr. Arnab, and very good evening to all. And this is a privilege for Bhopal Oncology Society to host this webinar and a webinar series of ISO. And this all we know is on the head and neck surgery. Because of COVID pandemic, we know all we have to, we are compelled to change our practice in management of different cancer, and particularly so for head and neck cancer. Because we all know the oropharyngeal mucosa harbor the COVID-19 virus. And because of this, the ISO Executive Committee have decided to have a webinar on the head and neck cancer, covering the neoadjuvant chemotherapy and metronomic therapy, difficult oral reconstructions. And apart from this, there is a complex topic of second primary or the recurrent cancer, which generally we face as a head and neck cancer and found difficult to manage. And for that, we have a very renowned head and neck surgeon, Dr. Ashok Shaha from the MSKCC. And Dr. Pathak, who is previously in Tata Memorial Hospital, he is now the director of the head and neck surgical oncology in Manitoba University, Canada, and he will be speaking on the reconstruction options in COVID era. And the last talk will be the metronomic therapy and neoadjuvant chemotherapy. So without wasting much time now, I would like to invite Dr. K. Pathak to deliver his talk, and this talk will be moderated by Dr. Rishil Savant. So first I invite Dr. Savant to moderate this session. Dr. Savant, please.